Good morning, everyone. Welcome to Metier YouTube channel. I hope you are all preparing well for the AIIMS and JIPMER exams. Today, we'll see the 5 important MCQs for the upcoming AIIMS and JIPMER exams. Okay? Nothing is impossible. Everyone knows that the word itself says, I am possible. So try harder for your success. We'll start today's section. First question. Molly with suspected rheumatic fever is admitted to the pediatric unit when obtaining the child's history. The nurse considers which information to be most important. So the scenario is telling that a child, Molly, is suffering from rheumatic fever. So as a nurse, what is the information we have to get it from the patient? Not patient, from the parents. Okay. So first option is a fever that starts 3 days ago, a lack of interest in food, a recent episode of pharyngitis. Option D is vomiting for 2 days. The correct option is option C, that is a recent episode of pharyngitis. Everyone knows that the rheumatic fever is caused by beta hemolytic streptococcus. So through the pharyngitis, the child can get a rheumatic fever. So the correct option is the nurse has to get the information from the parents regarding the recent episode of pharyngitis. Obviously, the child will have fever. When there is a fever, the lack of interest in food and vomiting will be there. These are less relevant to the scenario. So most relevant to the scenario is option C. A recent episode of pharyngitis is the accurate information to diagnose the rheumatic fever. Clear? Yes. Next question. A nurse analyzer is administering a medication via the intraosseous route to a child. Intraosseous drug administration is typically used when a child is. So the scenario is telling the medication they are going to give through the intraosseous route into the bone. The other name for the intraosseous is intramedullary. Okay, other name is intramedullary. So which age is the typically we can use this intraosseous route? The options are under age 3, over age 3, critically ill under age 3, critically ill and over the age 3. So what is the right option? The right option is critically ill under age 3. Remaining options under age 3, over age 3, critically and over age 3, all these conditions, that means above the age of 3 or under the age of 3, we can detect the veins easily. So when we can use this intraosseous, when there is a child who the administration is need more vigorously, we need to administer very fast way, or you are unable to detect the veins or arteries, that time you can use this critically ill under age 3 intraosseous drug can be administered. So it's very emergency. It's mainly used in the emergency situation. Okay. Typically when there is a child is under age 3, we want to administer the medication very rapidly. Okay, when you are not able to detect the veins, you can give this under the age 3. Because under age 3, who is critically ill, that we cannot detect the veins easily. So that is why the correct option is option C. So you can see this in this picture. This is the intraosseous, okay, or intramedullary. So what are the sites in the children? Proximal humerus, distal femur, proximal tibia, and distal tibia. Okay, so these are the various pediatric incision site for the intraosseous injections. Clear? So the correct option is critically ill under age 3. Next question. The nurse is aware that the most common assessment finding in a child with ulcerative colitis is what? Everyone knows what is ulcerative colitis. So what is the common assessment findings? It is very easy. It is profuse diarrhea. The child will have the profuse diarrhea. That is a common assessment finding seen in the ulcerative colitis. The remaining intense abdominal pain, anal fissure, abdominal distension are related to the Crohn's disease. Okay. So the common assessment is profuse diarrhea. Very easy questions, right? Yes. Next, a baby is born precipitously in the ER. Okay. The nurse initial action for the baby should be. Everyone knows a precipital labor, within 3 hours, the first and second stage, both together within 3 hours, the child will be born. especially seen in the multiparous woman. Okay. So in this condition, in this scenario, what the nurse initial action the question is asking. The options they have given: to ascertain the condition of the fundus, ascertain the condition of the fundus, they establish an airway for the baby. Option C, to quickly tie and cut the umbilical cord. Option D, to move mother and baby to the birthing unit. So what is the right answer? The right answer is establish an airway for the baby. So everyone knows that airway breathing circulation. So the airway of the baby is very much important. Okay, especially in the precipitous labor. Remaining also we have to do, but not see. Quickly tie and cut the umbilical cord. At least we have to wait for 1 minute. Okay, delay cord clamping is always good rather than the early cord clamping. Okay, early cord clamping, when will you do? When there is an emergency for the fetus, if you want to give the resuscitation measures, that time only we have to do the early cord clamping. But always normally delayed cord clamping is good. After 1 minute is good. Okay. So here, according to this scenario, the answer is to establish an airway for the baby is the right option. Clear? Yes. Next question. The primary critical observation for the UPGAR score is what? So already we have seen the UPGAR score in the previous sessions. So here the question is primary critical observation goes to which? Heart rate, presence of meconium, evaluation of the Moro reflex, respiratory rate. Tell me. So we most of them thinks that it goes to the respiratory rate. No, but it is goes to the heart rate. So what the studies and books are saying, when the heart is functioning good, so automatically the respiration, the lung maturity will be good. So always, so that is why the primary critical observation should goes to the heart. Clear? So when there is heart is functioning good, we can expect respiration is good. Clear? So that is why the primary critical observation goes to the heart rate. Clear? Yes. So that's all about today's session. And small suggestion, we are getting lot of response through the YouTube. So we are requesting suggestion from you, whether you are comfortable with a morning upload of this video or before going to the bed around 9 p.m. ஸோ உங்களுக்கு எது கம்ஃபர்டபுளா இருக்கு? மார்னிங் 7 மணிக்கு பார்க்கறது கம்ஃபர்டபுளா இருக்கா, இல்ல இதே வீடியோ நீங்க நைட்டு படுக்கிறதுக்கு முன்னாடி பார்க்கறதுக்கு கம்ஃபர்டபுளா இருக்கா? ப்ளீஸ் கமெண்ட் செக்ஷன்ல கமெண்ட் பண்ணுங்க. Who are all not subscribed our channel, please kindly subscribe and press the bell icon button so that you can get the updates regularly. Thank you so much. Meet you in the next session.